The hormone diet is my modified version of the HCG diet protocol. In this program, we still utilize the medication called HCG. HCG stands for human chorionic gonadotropin. It is used for a variety of conditions, but in this instance we use very low doses of it to help us lose weight. It does two things for you in terms of weight loss. It helps control and suppress your appetite. It also prevents muscle loss during weight loss. Now on this program, I also have introduced a concept called intermittent fasting. That means you'll be eating your food within an 8-hour window. The cost of the program is $150 to start, and then at $60 each week thereafter, and you pay as you go. You can stop any time, but you can only go to a maximum of 6 to 8 weeks. Upon finishing the 6 to 8 week program, you need to follow the maintenance, which is about 3 to 4 weeks. If you haven't reached your weight goal by then, you can do the program again, but you will only be charged $60 per week thereafter. Every week when you come in, you'll receive a brown bag like this. In it contains an HCG shots, the vitamin B shots, and some alcohol wipes. The HCG is a clear liquid, which will be injected daily, and the vitamin B12 lipotropic shots are injected 3 times a week. The purpose of these shots, the vitamin B12 shots, is to give you more energy. The lipotropics in there helps your liver burn fat, and there's also chromium in there to help balance your blood sugar. Now the first 2 days of the shots, you can actually eat whatever you want. The reasoning behind this is because it takes about 3 to 5 days for HCG to start kicking in to control your hunger. Now the first 2 days of the low calorie can still be quite challenging for some, but if you tough through it, eventually it'll become much easier and your hunger should be suppressed. Now, as you start the program, you will need to pick 8 hours of the day in which you're going to be consuming your food. Most patients will actually kind of skip breakfast, and they'll eat all their solid food between noon to 8 p.m. But it really doesn't matter. You can do 11 to 7 p.m. or even 2 p.m. to 10 p.m., whatever works for you. This diet is an 800 calorie, no grain, no sugar diet. You're only going to be eating certain fruits, vegetables, meat, and seafood that we will give you on a list. You're restricted to only those foods on the list. Now for breakfast, you can only have certain liquids. Patients will usually consume coffee or tea with no sweetener, not even stevia. You can add a little bit of cream. You can have water, vegetable broth, bone broth, soup. Then for lunch, you'll have to measure out 4 ounces of protein, 3 cups of vegetables, 1 fruit, and 1 slice of a Wassa cracker on Melba toast. You can have a snack a few hours later, which is 1 fruit, and then you'll have dinner, which will be the same quantity as lunch. Again, 4 ounces of protein, 3 cups of vegetables, and a piece of fruit, and 1 slice of a Wassa cracker or Melba toast. Now in terms of condiments, you can have any condiments except those that contain sugar. So no ketchup or barbecue sauce. But I encourage salt on the program, as well as any seasonings, spices, hot sauce, soy sauce, salsa, vinegar. And if you're going to have salad dressing, just pick the lower calorie-wise salad dressing. In terms of beverages, you're supposed to drink lots of water, about 2 liters per day. And you can have unlimited supplies of coffee, tea, vegetable broth, or bone broth soup. Now, side effects of the program. The most common side effect that I see is constipation. This is because we remove grain fiber from the diet. Now, although you're consuming lots of fruits and vegetables, most fruits and vegetables contain water, and constipation can still become an issue. If this occurs, we usually will prescribe certain laxatives like milk of magnesia, or possibly add fiber into the program in the form of Metamucil or Benefiber. Women who have periods can also be affected. Their period can become light or heavy, come early or late. There's no need to address this. This usually will resolve on its own once you finish the program. Now, with respect to the vitamin B12 shots, there have been some instances in which patients have developed an allergy to them. It is due to the amino acids that's in the shots. If this occurs, you'll get a rash in the area and it will be itchy. Please contact us if this occurs, and we'll have to change your vitamin B12 shot to one that does not contain the lipotropics. Acne can also occur for those that are acne prone due to the B12 shots. And if this also occurs, we'll have to omit those from the program as well. They will not affect the results of the program, but you might not have the benefit of increased energy with the vitamin B12. there are other options as well if this occurs. Supplements and medications. There are no drug interactions nor supplements that interact with the HCG. You can continue all the medications that have been prescribed by your doctor. However, those that are on insulin, we may need to adjust your dose while on the program. It's also suggested to take a multivitamin while on the program. Some of the main two things that slow down weight loss for patients is actually lack of sleep and stress, and this is due to an increase in cortisol production. We usually will prescribe a supplement called Cortisol Manager to help alleviate the high cortisol that might be stopping the weight loss. Troubleshooting. Some patients who are having issues losing weight is usually because they're too stressed or they're lacking sleep. So again, this needs to be addressed. Also, we will be sending you for blood testing when you start the program. Low iron and a low thyroid may cause a slower weight loss if they are not addressed. Also, constipation can also cause or slow down weight loss. And if this occurs, we will prescribe fiber or a supplement that can help loosen the bowels and help eliminate all the waste. If you're feeling tired and having leg cramps, this is usually due to an electrolyte deficiency. We'll ask you to increase your salt intake or possibly prescribe chelate. If your hunger is still an issue on the program, we usually will adjust the dose of the HCG until we find the right dose that curbs your appetite. Also, poor sleep, stress, low iron, and low thyroid could also cause hunger, and this might need to be addressed on an individual basis. Upon finishing the program, there is a 3-week stabilization you must follow. There will be a video that will outline all the specifics of the stabilization. But essentially, it's 3 weeks of no grains, no sugar. You can eat everything else, including dairy, nuts, seeds, and starchy vegetables such as potatoes and yams. You also need to double your calories and continue with the intermittent fasting. Weight training exercise is also very important on the program. So I do encourage patients to continue to work out with weights once they hit stabilizations, because the more muscle you have, the faster your metabolism will be. If you have any questions, you can always email Dr. Santos, myself, at drrodsantos@gmail.com. I'm here to assist you on the program, and I hope that we achieve your goal.